Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are discussing about a very important topic, which is nothing but PCOD versus PCOS. Many people, especially clients who are coming to our clinic, are asking us if they are suffering with PCOD or if they are suffering from PCOS, and what is the major difference between both of them. How does this affect the fertility rate? How does this affect the day-to-day life? How does this affect the menstrual cycle? And lot more other questions. So today especially we are dividing this topic, which is PCOD versus PCOS, into two parts. The part one will be discussing what is happening internally so that we are getting this disease, that is PCOS and PCOD, and how to differentiate them on a medical basis. And then in the part two we will be learning how to differentiate them based on the symptom basis. So let's dive into the topic. What is the definition of PCOD? So PCOD refers to polycystic ovarian disease. Disease is something which is very pertaining, or which is pertaining only to a certain organ. It can be reproductive, it can be liver, it can be heart. It is a disease itself, defines itself, or it limits itself to an organ. So here whenever we are speaking about PCOD, we are defining it to the reproductive system. So in the reproductive system, what is happening in this PCOD? There are ovaries which release a lot of immature or partially matured follicles, which turn into cysts due to hormonal imbalance. So what is PCOD? It is just ovaries releasing some immature follicles, which due to hormonal disruption are turning into cysts. So this is PCOD, which is pertaining or which is limiting only to the reproductive system. Second, we have PCOS. PCOS is majorly an endocrine disorder, as we can say, because there is problem in the release of GnRH from the hypothalamus, which is situated in the brain, and it stimulates to the anterior pituitary. Apart from that, if we see how else can we define PCOS? PCOS, the ovaries produce higher amount of androgens, that is testosterone. So there is hyperandrogenism with polycystic ovaries. So what is PCOS? PCOS is a syndrome. What is a syndrome? Syndrome is something that affects not only a particular organ but has its effect on overall body. So if you see, PCOS is not just a reproductive disease, it affects the blood sugar levels, it affects the insulin, it affects pancreas, it affects your calcium absorption, it affects your mental health, it has a lot of mood swings, it affects your endocrine function, and also it can have an effect on your thyroid as well. So overall it is causing some disruption, and overall the body, it is causing some symptoms. So that is syndrome. So what happens in PCOS, or how do you define it? Here there is cystic ovaries along with hyperandrogenism. This is how you define PCOS. Then what are the differences in their causative factors? If you see about PCOD, the causative factor for PCOD is hormonal imbalance. See, either in PCOS or in PCOD, we do not know the proper etiology. By etiology, I mean proper causation. We just assume something is happening in the body which is leading to hormonal disruption in PCOD, and excess androgen, excess androgen or hyperandrogenism in PCOS. It is an endocrine disorder. It is PCOD is strictly restricted to your reproductive disease. And then what is the age of onset? When I'm talking about age of onset, it doesn't mean that other people, of the age of, or for example, if I'm telling you that adolescents are being affected in PCOD, it doesn't mean that people who are in their 30s are not affected. It is that these people have a higher risk of developing PCOD. Or if you take 100 cases of PCOD, then 40 to 50% cases are seen in adolescent people. So PCOD is mostly seen in adolescent people, whereas PCOS is mostly seen in adolescents, but much more pronounced in 20s and 30s. Now coming into the pathological part, or how do you differentiate PCOD from PCOS pathologically? What system is running inside so that we are developing this disease? As you can see here, this is polycystic ovaries. So in PCOD, what happens is, whenever you are having bad lifestyle, by bad lifestyle I mean continuous form of stress, lot of tension for your exams, or for whatever reason you're feeling stress, and then you're having improper sleep, you're sleeping after 12 p.m. That is also a problem. If you're having less than 6 hours of sleep, or just 6 hours of sleep is not enough for people in reproductive age. So 9 hours of sleep is important. And even if you're taking 9 hours of sleep, that is you're sleeping at 12 o'clock and you're getting up at 9, that is also not considered proper sleep, because for hormones to get proper balance, you need, or your body needs, 10 o'clock to 1 o'clock sleep. That is very important. It is called hormonal repairing time. So if someone who is sleeping at 9:30, getting up at 6:37, I think they are much more healthier and will live for a longer period of time compared to people who sleep less and are sleeping after 12 or at 12 o'clock. So due to these lifestyle changes, if you're eating a lot of unhealthy food, packed foods, you're not working out, you're having stress, this causes hormonal imbalance, and this hormonal imbalance might be the main problem, where the follicles become immature and they become cystic in nature. This is PCOD's pathology. Let us dive into PCOS pathology. As you can see here, I will be discussing PCOS pathology. I will be drawing a chart wherein you can understand how differently this PCOS runs and how it is affecting different systems. Now coming into the cycle of PCOS. See, we do not know what causes or what happens or what is the exact cause of it, but all we know that this is brain, if you can see here, and in brain we have two parts, which is hypothalamus and the pituitary part. So the hypothalamus secretes a hormone called as GnRH, which will trigger the anterior pituitary gland. The anterior pituitary gland will be producing two hormones, which is luteinizing hormone and the follicular stimulating hormone. These hormones are responsible for follicle formation, and every time this is released, the follicles are formed, 6 to 12 follicles are formed. In that, one follicle will become egg and the others will disintegrate. After the release of the egg, the follicle will start to seize and it will become corpus luteum, which will release progesterone. This is the physiological aspect. But what happens, we do not know why and what happens, the GnRH is increased in this aspect here. Whenever there is increase in GnRH, the luteinizing hormone also increases, but the FSH can decrease. And this luteinizing hormone will trigger the ovaries which are present here. And this ovaries will not mature. The follicles in the ovaries will not mature, and the follicles will become immature and they will become cystic, and they will be anovulatory cycle. That is, there is no mature. When the follicles mature itself, you will have the release of egg, right? So here what is happening, the luteinizing hormone is affecting the ovaries, the theca cells in the ovaries and the stromal cells. Because there is no FSH or very little FSH, what happens, the follicles which are formed or which are triggered by this LH are not maturing. Whenever there is no maturing, there is no release of egg. So it is anovulatory in nature, that is, no egg is released. So there will be fertility issues here. And apart from that, whenever there is no egg release, that means whenever there is no maturation, when the egg is not released, there is no corpus luteum also, right? Whenever there is no corpus luteum, what did we say? There will be no progesterone coming out of corpus luteum. So there can be, because they are immaturely produced or immature in nature, E2 is a little less, but E1 is triggered by this LH, which is produced. These both are estrogens, right? But this is estradiol, which is important, the estrogen that we tell. This is E1, which is produced inside the fat cells. So this E1 is increased. Apart from that, this luteinizing hormone will trigger the ovaries to make androgens. This androgens will cause growth of mustache, side locks, male pattern baldness, hair on the chest and other things. And remember that we have this cycle which is of 30 days, right? So first day of menstruation, 14th day of menstruation, and then we have the 30th day of menstruation. Okay, or 30th day of the menstrual cycle. Here we will see estrogen surge when there are follicles, and then drop of estrogen, and progesterone surge when the corpus luteum. This corpus luteum is not forming in the PCOS. So whenever there is no corpus luteum, what will happen? The progesterone will decrease, right? This progesterone usually has an effect on the GnRH hormone. That is, whenever progesterone is released properly, GnRH will be in control. There is GnRH increase, then there is no progesterone to control it also. So this cycle will start running like this continuously. So in PCOS, we will be having irregular periods, we will be having polycystic ovaries, and also we will be having excess androgen, that is hyperandrogenism. Even if you are having any of these 5 categories, that is P for polycystic, I for irregular, and E for excess androgen. Any of the two also you can come under PCOS if you are having differences in your LH as well as FSH. If you see PCOD, you will not be having much of difference in all of this. You will be having difference only in your estrogen and progesterone. But if you see PCOS, you will be having hyperluteinizing hormone, low FSH level, low progesterone level, hyper E1 level, and moderate E2 level. So all of these things are disrupted in your PCOS. Apart from that, this PCOS will have other features that, like, it can cause diabetes mellitus, it can cause a sugar rush in the body, it can cause drop of sugar in the body. So all of this we'll be discussing in the next part. Okay. Now coming into the differences between their hormones. In PCOD, as you can see, we will have only difference in the estrogen and the progesterone level, whereas in PCOS we will be having differences in the LH and FSH ratio, LH levels, FSH levels separately, prolactin levels in some people can have hyperprolactinemia, some people will have differences in their estrogen, in their progesterone, and mainly if you want to check, you can check your LH and FSH level and your estrogen and progesterone levels. These are 4 hormones that you have to get tested for. If the estrogen and the progesterone levels, if the estrogen is high, the progesterone low, or if your LH is high and your FSH is low and your ratio is abruptly abnormal, then that means that there is a chance or there has already been pathology running inside your body and it is PCOS in nature and not PCOD. Then coming into the cyst formation, how do you differentiate a PCOS from PCOD? Seeing a USG scan. If you see that in USG scan, persons who are suffering from PCOD will have smaller cysts and less number of cysts, whereas people or persons who are suffering from PCOS will have larger cysts and more number of cysts. This is the basic differentiating feature between the PCOS and PCOD people. Now coming into the androgen levels, how do you differentiate a PCOS patient from a PCOD patient? In PCOD, which is disease, we do not see a lot of excess or hyperandrogenism, whereas in PCOS we see hyperandrogenism. It is a characteristic feature of PCOS. Now coming into the conventional form of treatment. As you can see here, either it be PCOD or it can be PCOS, you can observe that oral contraceptives or hormonal contraceptives or oral pills are something that they give in common for PCOD and PCOS patients. So how do these work? We can see, or if you have seen the pathology part, you will understand that there is decrease in the progesterone level. So to increase the progesterone level and so as to maintain the GnRH, they will be giving you progesterone only pills or progesterone releasing IUCDs, which is intrauterine contraceptive devices. Apart from that, these hormonal pills have some side effects or backdrops. What are these backdrops? First backdrop is that they do not cure the patient, they will only help in maintaining the disease not further complicated or there is no bad prognosis. So as soon as you stop these pills, you will again have a recurrence in the symptoms. Second thing, if you're taking pills and you have suddenly stopped taking them, or you forgot while you're going for a vacation, or you forgot while you're in your day-to-day chores, you forgot taking them, you can have intermenstrual bleeding as well. And then there is a fine line in this hormones. These synthetic hormones can trigger sometimes PCOS. They can make or help the PCOS to get into a bad prognosis. They can also trigger fibroid formation in certain section of people. Apart from that, there are other risky factors, which is oral contraceptives come with certain side effects like weight gain. Some people severe weight gain, acne, hair fall problems, hair loss problems. All of these are some of the features of oral contraceptives. And also the other backdrop, if you're someone who wants to get pregnant or who's trying to get pregnant, that cannot happen because you're using contraceptives. So this is the common form of treatment for PCOD and as well as PCOS. And then coming to PCOS, other forms of treatments, metformin. As I told you, PCOS can trigger diabetes, so they will give you metformin to maintain it. Anti-androgen hormones so as to decrease the androgen level, and because I told you PCOS is an anovulatory cycle, so they will be giving you medications for your ovulation, that is ovulation inducers also. Remember that all of the side effects are, there can be recurrence, there is no cure, there can be mid-menstrual bleeding, you cannot get pregnant with these medications, and also this is not the permanent solution. They have certain side effects attached with it, like for example metformin. It can decrease the muscle inside the body, leading to pains and aches and early deterioration in your bones as well. Now coming into the homeopathic part, this method of treatment is most safe method of treatment for PCOD or it is PCOS. See, as in allopathy, we do not have the same kind of medicines for any two people. Even though you're suffering from PCOD, if two people are coming to us suffering from PCOD, we will not give the same kind of medication to them, because each and every person is individual in nature. They are special in a certain manner, or they are different in a certain manner. So we note these differences. And apart from that, there is no intermenstrual bleeding. If you stop using these homeopathic medications, of course taking them regularly is important, but if you skip for a day or two, you might not experience any intermenstrual bleeding. They help in curing the disease, they help in maintaining your hormonal fluctuations, they will decrease the excess androgen symptoms, they will decrease your acanthosis nigricans, they can decrease your diabetes mellitus, they help in decreasing the insulin resistance, they help in maintaining a healthy body. The medicine that is given is holistic in nature, it is utterly safe to use, it does not have any side effects. You can plan for pregnancy even if you are using homeopathic medications. They help you in increasing the fertility rate, they'll give you better health, they will regulate your menstrual cycle, and apart from that they will relieve your present symptoms, cure your disease and prevent further recurrence. Coming to the precautions, what should you do if you're having or if you're suffering from PCOS or PCOD? Remember, PCOD is very easy to treat. Certain lifestyle changes along with homeopathic medications can help you a lot in healing from the disease within 6 to 7 months. But PCOS needs a lot of changes. Sleep cycle should be set up, that is you should sleep before 10 o'clock and wake up at 6 or 7. Your lifestyle which contains good amount of fibrous food, good amount of leafy vegetables, good amount of protein, healthy fats and healthy minerals, and decrease the consumption of processed or ultra processed food, decrease the consumption of candy, work on your vitamin D. If your vitamin D is low, try to take medications or supplementations along with getting a good sun exposure. And apart from that, working out is very, very important. When you increase your muscle will help in maintaining the glucose level in the body. So these are some of the precautions you need to take if you're suffering from PCOD or PCOS. What happens if you neglect this PCOS or PCOD? If you neglect this PCOD and if you're having really bad life cycle or lifestyle, you can turn into PCOS, and PCOS can in turn cause hyperandrogenism, facial hair, it can cause diabetes mellitus, it can cause thyroid issues, it can cause fertility issues, it can cause your uterus to develop other diseases like fibroid. Because of the hormonal disruption, it can trigger fibroids or even bulky uterus. We have seen a case in Fidicus Homeopathy which has complications of PCOS along with fibroids, and apart from fibroids and PCOS, they even have bulky uterus, and they were planning for a baby. So if you're coming with this much amount of complications, it will take time for you to heal. As well as not only that, homeopathy offers you much more effective rate in healing these things. And also, if you're neglecting this PCOS, you will develop all of these diseases and the prognosis can turn really, really bad. Not only for your ovaries, but also your uterus can get thickened, you can lose a lot of blood and you can become anemic, you can start to lose hair. So all of these complications will start. So if you're someone who's suffering from PCOD or PCOS, try to understand that you have to take doctor consultation as soon as possible. If you're someone who's suffering from PCOD or PCOS, you can contact us in person if you're staying nearby the nearest branch of Fidicus, or if you're staying abroad, or if you're staying very far from us, you can contact us online either through an audio or a video consultation option. And after the consultation has been done, we will ask you for investigations, whatever your case demands. And after the investigations, we will be after all this process is done, especially to the online clients, your medicine will be door delivered to you. If you're staying in India, 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And if you're staying in apart from USA and India, anywhere else in the globe, 4 to 8 business days. If you're someone who is looking for cure, you can contact us on this number. You can call us, message us, or WhatsApp us on this number. If you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here, if you're someone who's suffering from PCOD or PCOS or any other female reproductive symptoms, Why should you choose Fidicus Homeopathy? We have already discussed why should you choose homeopathy over allopathic form of treatment. Now we will be telling you why should you choose Fidicus Homeopathy apart from all the homeopathic physicians in the world. Because Fidicus Homeopathy stands for highest chance of health. Here we follow three principles. We are doing this video because we have high success rate in treating PCOD, PCOS, bulky uterus, endometriosis, adenomyosis, fibroid cases, and much more other cases. Here we follow three principles. High success rate. We are already having or experiencing good success rate in people who are suffering from PCOD and PCOS. And apart from that, transparent treatment. That is, there is no gray area between the patient and the doctor. Here we will be explaining it to you clearly what the prognosis and how your case is going to run. And the personal care here at Fidicus is top notch. The reason why we are doing this video is because we care about our patients. They are asking us a lot of questions about these topics. So that is why in order to educate them, we are doing these videos. So the personal care here at Fidicus is top notch. We will be answering all of your queries and educating you on your disease. So if you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.